a real opportunity to prioritize behavior change when the legendary behavioral expert Richard Rubin became president of diabetes in 2006. That was an amazing moment when someone who was so focused on behavior became a leader of the entire organization. And we're still talking today about how great that moment was in 2006. Richard Rubin's legacy is amazing and is with us every moment. We also need to stop talking about that moment and make his legacy even more powerful by acknowledging behavior change in a much bigger way and addressing it. We need to stop congratulating ourselves for talking about behavior change and actually start to do more about it. So much of that has to do with funding even more research. There are some isolated pockets of behavior change work being done today that are absolutely brilliant, and it is a labor of love for the people that are doing it. And we need to embrace the importance of behavior change much more wholly. Diabetes is a chronic disease that asks patients to do something extremely challenging, making short-term sacrifices for long-term benefits. People know they need to do it, but it's really challenging. This comes up with the environment as well. This comes up with inequality in America. There are many ways to think about this. There is not nearly enough focus on behavior change. When we ask leaders, if you were given $500 million next year, if you were given $10 billion next year, what would you do with it? And we've asked some legendary investigators, researchers, clinicians about this, and what's really fascinating is there's not very much consistency. It means there are a lot of places to spend the money, but it also means that we are not investing in enough resources for them to work together as optimally as they could. So one thing that we could do is think about different frameworks for considering behavior change. So we've thought about a couple of different things here. There are several questions that we would ask. We ask these questions for drugs, for technology. Let's also ask these same questions as we think about clinical trials. Let's look at these questions as far as behavior change goes. So we need a new framework. It could center on several different questions. How effective is the behavior change that we're asking for? Is it 10% better? Is it 10 times better? We need to shoot for the moon instead of just the ceiling of a conference hall or an office. The behavior changes that we're talking about, are they safe? Are there any side effects? So the behavior changes, who are they good for? Are the behavior changes especially good for those who really need help, who have no access to education? If they are, then that's really important, and then we need to get more investment in those areas. How easy are the behavior changes to prescribe, to teach, and to support? We have to make providers' lives easier, and that will attract many more of them. How much does the behavior change cost to deliver? We're asked to think about cost all the time. So we need to do this in a much more robust way in clinical trials so we can actually see the power, so that again, we will be able to get the ultimate reimbursement that we're looking for. How much does that cost to deliver? Really honing in on these questions far ahead of reimbursement discussions is critically important. The trials that are being done to show efficacy, safety, they also absolutely need to show cost and just show benefits. A better understanding of human behavior might be the bridge between the drugs and devices that we have now and the outstanding outcomes that we're all looking for.